Shall we do anxiety? In our scenario earlier, Joe is anxious about his wife. Also, Joe expressed his anxiety about dying. Okay? So help me. What is our nursing problems in terms of that? Again, the patient is afraid of dying and the patient is anxious about his wife. So what would be our nursing problems? Or a nursing problem rather
Anxiety is experiencing anxiety due to
about his wife. Can we write this? Can we also write Joe is experiencing anxiety about his condition? Yep. Thank you, Ziggy. Thank you for that condition. Is I'll just ask you guys, is fear of death a normal occurrence? Are we afraid of dying? Is this normal? Yeah? Probably this is normal. Yep. So probably Joe is experiencing a normal process getting anxious or afraid of dying. Okay? So along these lines, you could write your problem. Okay? So what is our aim of care for anxiety? So if you ask me, anxiety is one of the hardest care plan for the examination. Okay? So this is I will give you a tip. On the examination, we have 8 scenarios. There are a couple of scenarios wherein the patient would express their anxiety or fear of something. Okay? So you make sure to perfect this care plan for your examination. So what is your aim of care? Please do help me type your answer. Joe, thank you, Dala. Joe will demonstrate decreased level of anxiety and will be able to identify ways to cope with it. That's very good. Joe will be able to express his feelings. What else? Do you have any other thoughts? So if you notice for the aim of care, there are words that will make your aim of care measurable. So earlier, if you recalled, for the pain, our measurable aspect of aim of care is the score. Can you remember that? For the respiration earlier, the measurable part of it is the breath, the cycles per minute. So this one, what will be our measurable aim of care? So it's the word verbalize. Okay? Or that I said, demonstrate. Well done. So these are the words that would make your aim of care measurable. Verbalize, probably decrease in level of anxiety, decrease level of anxiety, and we'll be able to identify ways to cope with it. Probably, let's just remove this one. Joe will verbalize and decrease level of anxiety. So when are we going to reevaluation the patient? So if your patient is anxious, when are you going to reevaluate the patient? Most especially the patient experiencing, again, apart from anxiety, the patient is also out of breath. The patient is also experiencing pain. So probably is an hour reasonable for this patient? Michael said yes. Thanks, Michael, for that. Okay. Um, Care provided. Thank you, Dina, for answering as well. So now we will now go to our interventions. Again, you are not limited with these words. Thanks, Benjamin. He said, assess the level of anxiety. How are you going to do that? Level of understanding. A screening tool. Oh, the use of PHQ-9. Guys, remember, so if you've, thank you for that. Thank you for your answers, guys. So, Angelica, thank you for that. So, remember, guys, PHQ-9 is only intended for patients who are experiencing depression. Assess the level of anxiety or to make this assess. How about the signs and symptoms of anxiety? Can we write this instead? Assess for any signs and symptoms of anxiety. Yep. Do we know what the symptoms are or the signs of anxiety are? Probably you've seen one or you experience it yourself. Yeah. So probably like there are people when they're anxious, they talk a lot, they talk fast. Some people, if they're anxious, they keep quiet. Okay. So it depends. So how about monitor? What are we going to monitor? The one-year screen, is this correct? Could we also monitor the patient's observation and escalate as per news policy? is this also applicable for anxiety? If you're anxious, I'll give you an example. If you're anxious, will this affect your blood pressure? Yeah, thank you guys. They all agree. Okay? So if you're anxious, will this affect your heart rate and respiratory rate? Of course. Okay? We all experience that. All of you probably are anxious about your examination. Okay? Sorry for reminding that. Okay? So you might experience this. So this one is also applicable. So provide. So provide, think about environment. So what are we going to write here? Probably you know the answer now. Provide a calm and quiet environment. But I also like Mark's answer. He said, provide accurate information about the situation or the condition. So this is one of the instances wherein you give information to the patient. Probably this is one of the instances wherein you explain what is happening to the patient. Probably the patient is anxious because he doesn't know what is happening to him. Okay? Sometimes we need to educate the patient. Again, we have to use our communication skills. Okay? We need to use words wherein the patient could understand it fully. Okay? So well done. Thank you guys for sharing your answers. Are we all happy with this? No violent reaction so far. How about administer? What are we going to administer the patient with? If you cannot think of anything, we will just skip it. Anxiolytics monitor its effectiveness. There you go. So you could write this, but then again, so not everyone might receive anxiolytics. So probably not for this patient. But again, this might be correct. Okay, this might be correct. After writing this on your care plan and you did not administer any anxiolytics on your implementation station, please do not write it on your evaluation letter, or please do not hand it over during your evaluation if you're doing the new test of competence. Okay, we will have a different or separate conversation about this on our next webinar with needs and further concerns. How about in terms of communication, your communication skills? Can we also write use? Let's say use the word use. Open-ended questions. Can we use this? Yep. So do you know what an open-ended question is? So these are the questions not answerable only by a yes or a no. Can we also demonstrate compassion? Yep, compassion to your patient. Okay, or non-judgmental attitude. Thank you for that. Educate about deep breathing exercises and relaxation techniques. Well done. Thank you. That is definitely correct. To educate about limiting caffeine intake is very good. Okay, so you have also remember caffeine can also increase this, of course, mindfulness and relaxation techniques. Well done. Well done. Those are all correct. First sleep breathing can also be correct. Okay, well done. How about refer? Where are we going to refer the patient with? The patient is only anxious about his wife, or the patient is afraid of dying. At that point, do you think the patient needs to be referred to a psychiatrist? No. Okay. Thank you. Of course not. The best answer is to the medical team. Okay. If it becomes chronic and it's out of hand, probably we will go to the next step. But remember, at that point, probably psychiatrist is not the best referral. Okay? Or a psychologist is not the best referral. The patient is afraid because of, can we also call the wife? Let's say arrange. Can we also call the wife? And probably the wife could talk to Joe. So Joe would know what's happening with his wife. So any questions? Are we happy with this? So do you think we managed to build a good care plan for your anxiety? You have a lot of options now. Okay? For the patient's healthcare activities, we will not answer this at this point. I know you know how to answer it now. Guys, this is asking, is it the same? Yep. Everything is the same apart from the patient's healthcare activity. Okay? This one is not applicable for the new test of competence. Okay? The patient's healthcare activity is the only section of planning not applicable for the new test of competence. Yeah. Let's talk about post-op. So the aim of care is Joe is at risk of infection following post-operative procedure. So when are you going to reevaluate the patient? So I'll give you the scenario, okay, to enlighten everyone. Let's say it's a different story now, okay? It's still Joe. Let's say Joe had a hernia repair, okay? The Joe is post op, his post hernia repair, and then you are receiving the patient. So the patient, you said, is at risk of developing infection. So there is a portal of entry. Remember your chain of infection? The portal of entry is the patient more susceptible of developing infection. So Roslyn said 4 hours. Any other thoughts from the crowd, higher or lower? Thanks, Sir Dennis. So as per protocol, thanks, Mark. Mark said as soon as possible. Well done. So the hospital policy is normally after upon the patient's arrival, normally we monitor the patient's observations every for 15 minutes in the first hour, every 30 minutes in the second hour, and then after that we monitor the patient every hourly for the next 4 hours. Then after that we will monitor the patient based on the observation. So that means we have to monitor the patient frequently, okay, or as soon as possible. Remember, the patient has an operation, is the patient more susceptible in developing infection? Of course. Even if the problem is not existing yet, remember the patient is really vulnerable in experiencing infection. Do we all agree? Same as the one on your screen, we could probably write after 1 hour. We could also write, oh, Emmer, could we write 30 minutes? Why not? The post-operative site. Well done. That's it. That's the answer. What else? Or assess the post-operative site. He said, observe for the signs of infection such as fever. That is very well done. Or simply say, it's already written on your screen, monitor the patient's observation and escalate as per news policy. So remember, your observation might be telling you if their patient is experiencing early signs of infection. Provide. Think of a skill. Think there are 16 skills. So what do you think is the skill that you've learned or you will be learning that is applicable for post-op? Well done. Thanks, Klein. Okay, so he said, provide wound assessment and dressing. So, yeah, well done. Yep. So are we all happy with that? So when you're, another tip for your planning is, think of the 16 nursing skills for the OSCE. One of those might be applicable for your care plan. Okay? So perform a septic non-touch technique when dressing the wound. Okay? So are we all happy with that? Yeah? How about administer? We could administer antibiotics as prescribed. I'll just copy your answer. And don't forget the phrase and monitor its effectiveness. Well done. Effective, effectiveness. There you go. Well done. How about assist or any other words you want to add? Do you know what? We skipped one part of the care plan. I forgot. The aim of care. What is our aim of care for this one? Sorry, before we go back, I forgot. What is our aim of care for the patient at risk of infection? Joe? So Dina said will not develop infection at operative site. Or to make it better, probably will not experience, or you said develop signs and symptoms of infection. Because when you say signs and symptoms of infection, it's the fever, it's the pus, it's the pain, it's everything related to infection. Or Michael also said the patient or Joe will be free from infection. You could also say that, yeah? That is also correct. Okay? So going back, how about educate or refer or any other words before we end the night? So let's say educate. So what are we going to educate the patient with? Well done. Well done, Benjamin. So Benjamin said, educate about proper hand hygiene. Okay? We could also write that. What else for educate? We have a lot of things to write for educate. Sorry, I'm not screaming. Educate about, you said, proper wound care. Just remember, the patient will go home soon. Okay? The patient will definitely go home, and the patient should know how to properly care for his wound. So that's very well done, Andina. And also Criselda said proper hand hygiene. Yeah, proper hygiene or proper hand hygiene. Okay, well done. So yeah, what else? Refer, educate on medicine compliance. Probably that is not applicable for this scenario, Criselda, but that is also correct. Okay, but that's also correct. What else for patient at risk of developing infection? Can we also educate the patient about how about wound healing? How do we promote wound healing? Okay, that is a hint. Vitamin C, proper diet. What else? How do we promote nutrition? Well done. So that is it. That is the answer. Educate the patient about proper nutrition. What else? Can we also write what is the best nutrition for a patient post-op? Is it high protein probably? High protein. Can we also put high caloric diet? The patient needs to eat, isn't it? What else? Can we also educate the patient about adequate hydration? Yes, thank you. Can we also educate? What are the other things that would promote wound healing? How about early ambulation? Is that a yes? So definitely, these are the possible answers or interventions for your care plan. We will promote blood circulation and we definitely promote wound healing. Okay? Deep breathing exercises, of course. Thank you, Mark. That's also applicable for the patient. Refer. Lastly, before we end the call. So refer. To whom are you going to refer the patient? If you're going to write medical team, that is also correct. And remember, who is the team responsible for the operation? It's the surgical team, yeah? Surgical team. So couple of you actually answered tissue viability. So when do we refer the patient to a tissue viability nurse? Okay? So let's answer this before we end our session today. So when, I'll give you a question. When will you refer the patient to a tissue viability nurse? Is a surgical patient appropriate for that or not? Who could answer? Yes, according to Dina. Any other answers? Exactly. So the answer would be for pressure ulcers. Okay? So can you imagine if do you mean to say that all surgical patients tissue viability nurses will see them? Of course not. Okay? So tissue viability nurses, it's for pressure ulcer. Okay? You could also refer surgical patients to tissue viability nurse if, let's say, the wound is not healing properly. Okay? So remember, if the wound is not healing properly, and probably it will become like there's like infection, and then it can be gangrenous. Probably we need some advice from tissue viability wound. But normally, we refer the patient to the medical team or to the surgical team, but not to them. Okay? Because they are more responsible in pressure ulcers. Okay? So please do remember that. So any questions? I hope our session today was useful.